before you clock in, let's make it make sense. Anticholinergic edition. My name's Kate. I've been a nurse for 15 years, and these are concepts that have actually helped me. So anticholinergics, we have can't pee, can't see, can't spit, can't shit. Now that came from nursing students that I taught. They actually taught me that. So this information is for anticholinergics. There's a difference between cholinergics and anticholinergics. So right now we're talking about anticholinergics. And these are potential side effects that you can see. So can't pee is a side effect of an anticholinergic. It's also why if you have a post-op male that can't pee, check him for a scopolamine patch. Pull it off. It might help him, okay? Can't see. That one does double duty, so I think about it for two reasons. One, medications like scopolamine and atropine can cause dilated pupil. So if you've ever worked in post-op, you'll see discharge instructions for patients going home on scopolamine patches to not touch them with their fingers and then touch their eye. They'll end up with the dilated pupil. But I also remember it here because it's contraindicated in patients with narrow angle glaucoma. They shouldn't use anticholinergics. And then can't spit is dry mouth. Sometimes we want that, right? Like that's why they have the scopolamine patch on to begin with, but it is considered a side effect. And then can't shit is constipation, which is a side effect of most anticholinergics. So it's great that we know the side effects of anticholinergics, but what meds are anticholinergics? So BOATS, B-O-A-T-S, is how we remember that. Benzotropine, that's a med you'll see for Parkinson's. Oxybutynin is an overactive bladder med, right? So that's what we want. We want that can't pee. But on the other side of that, we're going to be cautious giving that to someone with like BPH that already can't pee. Now the AT is for atropine, and I remember atropine versus adenosine. AT, T to make tacky, adenosine, D to bring down, and that's in regards to your heart rate. So I'm talking atropine is a med that will increase your heart rate. Unless you're working emergency medicine, really the only place that I see the atropine is in eye drops on med-surg. So that has the potential to dilate that pupil. And then S is for scopolamine. Scopolamine is a common patch given for motion sickness. So you can see it on someone going on an actual boat, right? Or I see it in my post-op patients. It's a small patch. We typically place it behind their ear. Now, in discharge instructions, we talk about making sure after they take it off, they either take it off with gloves or wash their hands and not touch their eyes because it can cause that dilated pupil and actually blindness, which is super scary. So just to put this all together, a lot of the side effects of anticholinergics are the reason we are giving them. It's basically the mechanism of action. We don't want excessive secretions, so we dry them up. We don't want overactive bladder, so we block that. See, it's not that hard. We'll get through it.